Hello, my name is Sue and I'm the Chief Nurse at Ashford and St Peter's. Today we're making a very special video focusing on patient experience, and we're delighted to be joined by a recent patient, Ollie, and his mum Susannah. Ollie was very unwell earlier this year and was admitted to St Peter's, where he was cared for on one of our paediatric wards. We're really pleased to say that Ollie has made a full recovery, but it was a very worrying time for his whole family. Today we're speaking to Susannah to understand her experience of the care that Ollie received whilst he was a patient at St Peter's. Hi Susannah.
Hi.
Thank you so much for sharing your story with us today. Can you tell us a little bit about what happened to Ollie earlier this year?
Yeah, well, it sort of started back in April and he just became really quite unwell at home with a high temperature and a strange pain in his side. We sort of monitored him at home and then eventually went to the GP, but by then he was really poorly, so they sent us straight to A&E, and that was when we sort of started our journey here at St Peter's. And unfortunately later that afternoon he really became very unwell very suddenly, which was really frightening. We were up here on the ward, went down for an ultrasound. He was in a lot of pain, and then that was when the decision was taken to transfer him up to St George's for a surgical opinion. And we spent some time at St George's, and whilst we were there they diagnosed quite a serious kidney infection, and once he was sort of just starting to show some signs of recovery, we came back here and had another little stint here until he was well enough to go on to the oral antibiotics and go home. And you walk out of your house to go to the GP and you don't come back for 7 days. I didn't have anything with me. We just went straight from the GP into A&E and here, and then to St George's, and then back here, and that was a total of 7 days. And I've never really been away from home. I'm a full-time mum. I'm very lucky to be a full-time mum, and they're only 6 and 8. Charlie's 6 and Harry's 8, and so it was a big deal. We parachuted my mum in, and that was hard work. I think one of the things that prompted me really to sort of get in touch with you afterwards was just that the communication was so good. It's frightening when your child's ill, and it's even more so when you don't know what's wrong, and in fact when the people caring for your child don't know what's wrong either. The honesty of actually we don't know what's wrong, but we're working on it and we're working really hard, and we're going to tell you what the plan is and we're going to stick to the plan. And for me that was just so key, because when you're told something's going to happen, as a parent you're in a really high state of anxiety and your child's really poorly, and in fact he was becoming more poorly as the time went by. To have that opportunity that everybody just stuck to what they said they were going to do and did it when they said they would was one of the things that I really kind of took home with me. Very reassuring.
So what particular points of communication would you pick out during Ollie's stay here?
The nurses were all excellent in terms of just keeping me informed about what was going to happen and when. The doctors always told me what was happening, and it happened when they said it would. There were a couple of acutely stressful moments, particularly when Ollie became seriously unwell. I was trying to control myself, but obviously panicking at that point. And Karen was with us at that moment, and at one point she just put her hand on my arm, and it was just that kind of silent communication of her just trying to say to me, it's okay, we've got this, we're on it, and we're going to be okay, and you're going to be okay, and Ollie's going to be okay. And it was just the way that 1,000 words were communicated by just doing that. Yes. And that, in that really stressful moment, just took the edge off it just a tiny bit, Sort of another point of stress, just travelling back, again, it happened to be late at night and Ollie needed his antibiotics and he hadn't had them, and there was a delay and I wasn't sure where the paperwork was, and I'd sort of felt quite stressed just moving from one place to another. And I actually spoke to Emily on the journey, on the way, and she was just straight away really reassuring. She said, no, we're all ready for you. We've got Ollie's antibiotics ready, and don't worry, the paperwork's here. And as soon as I got here, she just greeted me with a hug and a cup of tea. And although I was just really conscious of Ollie, I think she just clocked that actually the person that just needed a bit of emergency care in that moment was me. And just for a few minutes, just that reassurance of a hug and a cup of tea, and then they sat down and we went through everything. And the doctors came and they immediately wanted repeat blood tests of everything. They wanted to just get the full story again from their side. And then the intravenous antibiotics were given and he had some tea, and we just, everything was taken care of.
You speak lots about their communication and the care and compassion, but what do you notice in the teamwork? What did they bring specifically to you as a parent in observing the teamwork?
They're clearly a great team and they love their job, which is fabulous to see that. They're, obviously happy to be here, want to be here to help. Michaela came with us in the ambulance. She could communicate a little bit with the paramedics as well, so that took the pressure off me too, because I wasn't having to give them any background or anything. It was all being taken care of. And that continuity of care that's a good example of it, but it was exemplified throughout everything, the communication from A&E, communication within the team, and then communication to St George's. It was all exceptional and just meant that I didn't feel I was having to chase anything or do anything. I was just able to just support my child whilst he was ill. When you're in that emergency phase and you're not sure what's wrong with your child, and then they have some treatment and you need to wait to see if they're getting better, you don't really ask the questions about why and what happened, and you don't have time to reflect. But once we came back here and we knew Ollie was on the road to recovery and was turned a corner, we had so many questions about what had happened and why, and had we done the right things, and why had it ended up sort of feeling like an emergency situation. And just to process that, my husband was with me at the time, and we just spent some time with Dr. Hill, and she was so reassuring and so good at answering all our questions, and just really took time. I think she must have been in the room not much short of an hour with us, just answering all our questions and reassuring us, and really that helped us to reflect on it all and just to feel sort of a bit more calm about what happened and why. And that, just another example really of someone going the extra mile. I'm sure at 9 o'clock at night after a long shift, she probably much preferred to have been at home, but she really took the time to answer both of our questions. And
you talk about a lot of things that we did well. Is there anything that you think we could have done a little bit better to just made that difference to Ollie's journey or another patient's journey here?
It was just consistently outstanding in every area, really. And to be honest, I'm struggling to give you anything that I can say on this occasion that you could have done better. I just, you looked after Ollie, made him better, looked after me. I can't really give you anything else to...
Brilliant to hear. Thank you very much. It's fantastic to hear the exceptional level of care and compassion that Susannah and Ollie received during their stay at Ashford and St Peter's. Well done, team. This is exactly what we strive for here at Ashford and St Peter's, and it's directly in line with our vision, our values, and our strategy. Thank you.